Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone. Inshallah, we are going to start with biophysics because I want your full concentration. Hello, Dr. Amina. Biophysics, guys, answer. I'm sorry. Biophysics questions are the easiest in the exam, and I call it easy marks. So please, I don't want any of you lose those marks. Usually, they ask you about either definitions or side effects or complications, or some basic information about radiation dose and so on. But the main problem for candidates are mainly ultrasound basic principles and Doppler, of course, and diathermy. So we're going to revise together, inshallah, in this session, everything we need for the exam. This is a very common question. What is the frequency of a transvaginal ultrasound scan? Anyone know? Yes, excellent, excellent. It's about 6 millihertz. Excellent. With regard to ultrasound with color Doppler, how can the blue color flow pattern be described? Many of the candidates think that the blue color is for the venous return and the red color for the arterial flow. And this is, of course, a misconcept. It has nothing to do with the venous or the artery. It's about the direction of the flow. So when we say blue, blue means hate, right? So blue means the blood is going away from me. Red means love. So red means the blood is coming toward me. So blue is the flow away from the color box. Okay, and we are going to revise together which kind of Doppler gives us this opportunity. The opportunity to know the direction. Because red means love, blue means cold or hate. So blue means move away from me. Okay, this is the difference between transvaginal and transabdominal ultrasound in means of frequency, resolution, and penetration. Okay, and please concentrate with me because this question is very easy and I still don't know why candidates answer it incorrectly. We have two probes, mainly in our practice. We use two main probes. There are several kinds of probes. Only two probes are usually used in gynecological and obstetric practice, which is transvaginal, of course, and the transabdominal. Transabdominal probes are usually curvilinear, like this. Curvilinear means they are not straight, like the cardiac and the vascular probes, and they are not totally convex, okay, like the vaginal probe. It's like this. Curvilinear means it is curved and also somehow wide in curvature. Okay? The best resolution is depend on what? The resolution depend on what? Depend on how many crystals are there in the probe. Each probe has many crystals. Those crystals' main function is to take the ultrasound waves that is directed toward the tissue, reflected back to the crystals. The crystals like what can you say? Like our brain, they translate the waves into dots. Those dots, I just want a little pen. Those dots together form the picture, just like the TV, the television. The television is mainly picture. I mean, the television picture is mainly about dots, small dots together, linked to each other. They form the whole picture. Some of them will be bright dots, some of them will be gray dots, some of them will be black dots. Okay, so when the crystals are many, that means the resolution will be higher. Those crystals, when they are concentrated in a small area, the resolution will be higher. That's why the transvaginal probes have higher resolution more than the transabdominal. Why? Because the transabdominal probe, like this, have the crystals scattered all over this area, while the same amount of crystals are scattered in smaller area in the transvaginal. That's why we will have better resolution with transvaginal. We will have higher frequency, and in the transabdominal we will have lower frequency and lower resolution. The only advantage of transabdominal ultrasound or transabdominal probes are the higher penetration. This is the area of conflict. How? Let me explain it quickly. If this is the skin surface, let me get a pen, sorry. This is the skin surface, okay? And I'm having here the probe, here, this one and this one. They will transmit the ultrasound waves. They will hit an object here, for example, the uterus. The sound waves will hit the uterus and return back to the crystals. The crystals will translate those ultrasounds to dots that will appear in the screen. Sorry. Okay. So they discovered that the lower frequency waves have higher penetration, which means they can travel for a longer distance. So if the uterus here have ovaries behind it, this low frequency waves can see also the ovary, and there will be reflected waves from those ovaries. While the higher frequency waves, yes, they have higher resolution, yes, the picture will be more clear, but they don't have higher penetration. When they hit the uterus, all of the waves will be reflected and none of them can penetrate beyond the uterus. So every one of those have advantage and disadvantage. Transabdominal ultrasound have less resolution, so its picture will be not as clear or crystal clear like the transvaginal. In comparison, of course, because now in the new modalities and new clarity of the crystals, the new technologies, transabdominal ultrasound become very, very good quality of pictures. But in comparison with transvaginal, it will be less clear. Okay? But they have a very good advantage, which is the higher penetration. So in means of, for example, an obese woman. So the skin now is like this. I'm having all of this is adipose tissue. All of this is adipose tissue. And I'm still having the same probe here, the abdominal one, okay? And the transvaginal one. For example, I'm applying it to the skin, okay? We are now talking about the skin and the transvaginal one here. And I'm trying to see the difference between them. The transabdominal ultrasound or the transabdominal probe have low frequency, so the waves will enter the adipose tissue and it will enter the subcutaneous tissue also, and until it will reach the uterus and come back. The transvaginal one will show me high details of adipose tissue and subcutaneous tissue, but it will never show me until it reaches the uterus. Why? Because of the low penetration. Got the difference? So when I'm having an obese woman and I want to see the uterus, yes, of course, the transvaginal will be a good option. I'm not saying anything, but they don't ask you like this. They ask you which kind of ultrasound is the best for her in means of physics. Means of physics. Of course, the one with lower frequency and higher penetration. This is the question. When you're having an obese woman, which kind of ultrasound will be the best for her? They don't give you transvaginal and transabdominal in the options because this is nonsense. This is total nonsense. Of course, the transvaginal will show me better in any woman, not only the obese. But not every woman will accept to do a transvaginal ultrasound. So in means of physics, we will choose the probe with lower frequency and higher penetration. Okay? Is it clear? Because this one is very important and we will depend on those principles later on. عليكم السلام ورحمة الله وبركاته دكتور هبة. Okay? Can we move on? Any transabdominal ultrasound is curvilinear. There is no straight abdominal ultrasound or no straight abdominal probe. The straight one is called cardiac probe or vascular probe. It's not called abdominal probe. Okay. And I can tell you later on if we have time the difference between them in means of penetration and resolution also when we revise the definitions. But we have a question here about the DEXA scan. The DEXA scan report in two ways, by the way. Now, if you are going to order a DEXA scan for your patient, the report will come with both T-score and Z-score. Okay? T-score is what and Z-score is what? Can you go through the options and tell me which one is correct? By the way, the WHO depend on the T-score. T. Why I'm saying so? To remind you that WHO will not use something specific. It will use something universal. Okay? So we can say that the T-score is a comparison of a person bone density with that a healthy 30-year-old of the same sex. So when I'm comparing a male, I will compare him with a healthy 30-year-old male. If I'm comparing the bone density of a woman, I will compare her with a healthy 30-year-old woman. So it's easier. That's why the WHO depend on, or the definition of osteoporosis and osteomalacia and so on depends on T-score. Why not that score? Because that score is more specific. That score is a comparison of person bone density with that of an average person of same age and same sex. So if I'm having a lady who is 60 years old, I need to compare her results with a lady who is also 60 years old. Okay? That's why when we have the definition of osteoporosis and osteopenia, according to the WHO, it will be a T-score. T-score of negative 2.5 or lower will be osteoporosis. So negative 2.5 or lower. From negative 1 to negative 2.5, it's called osteopenia. More than negative 0.1 is normal. Okay? Why we don't use that score? Because as we said, it's more specific and it needs a specific population to comparison to. And also, low Z score can sometimes be a clue to look for a cause for osteoporosis. Osteoporosis only. It can be a clue, but it's not diagnostic. Okay, anyway, we are just revising over the question and I will revise with you the definitions again. Here, if you wish to achieve a cutting and simultaneous coagulation effect from the diathermy machine, how this is best achieved? Anyone knows? If I want to have the cutting and coagulation effect at the same time, let me remind you that only one form of diathermy can do the cutting effect. Which one? The monopolar or the bipolar? Excellent, the monopolar. So if I want to have a cutting effect, I should choose monopolar. Okay? So this one will be monopolar diathermy with blended waveform. We are going to revise the waveforms, don't worry. In monopolar diathermy, which feature prevents electrocution occurring? This one is an exam question, a very famous recall, and why they bring it back again and again because I have seen many silly answers about this question among the groups. That's why there is a universal misconcept about this question, which reflects, by the way, that we know nothing about diathermy. Why we don't get electric shock when we use the monopolar diathermy? This question, by the way, reflects how much you know about electricity and how much you know about uh, the circuit of the diathermy. No, actually, Dr. Saira, this is the answer that all groups answer. The patient is Earth. The patient is not Earth. The machine is Earth, not the patient. Any machine or electric machine in our house or anywhere should have earthing, a kind of earthing, so that we are not going to be electrocuted or have electric shock when we touch it. It should be insulated or earthed. The patient is not earthed. In monopolar diathermy, guys, the patient is a part of the circuit. I can show you a picture better than drawing. So the answer here will be because of the high frequency of monopolar diathermy, and I will tell you how. It has nothing to do with the current or the voltage, okay? Okay, because if the voltage is high or the current is high, we can get, yes, electrocution, but it has nothing to do with it. It's not because we use the direct current, because diathermy is not a direct current. Diathermy is alternative current. And of course, the patient is not Earth. As I said, the machine itself is Earth. And I will tell you why. Who can answer this one? Yes, this one is really easy because we are talking about invisible laser. Invisible laser means I'm not going to see the beam. I'm not going to see the beam transmitted. Okay? So we are talking about a gas. So the only one that could be like the question is saying is the carbon dioxide. Okay? Argon is also a gas, but it transmits a beam. And it's not transmitted through a fiber optic cable. This one is really, really a famous question. They are not going to ask you about the other types of laser. But anyway, all of them are types of laser. The most common one in our practice is the neodymium, which we use it sometimes in cases of anesthetic gynecology or cancer treatment and so on. At the end of surgery, you notice an area of burn near the attached diathermy plate. The diathermy plate seems to be partially detached. Which of the following would be the most likely etiology? Very famous question. They always ask you, or the question revolves around the concept of what happened when the return plate is misattached or partially detached. And which kind of diathermy we use the plate or return plate? Yes, excellent. It's A, due to the plate not being secured properly. In monopolar diathermy, guys, we need a plate to be attached to the patient's thigh because we work on the pelvic area. So we attach the plate to the most or the nearest side that can be having a good amount of adipose tissue. We not a joint. We cannot attach to the plate to a joint because it will be misattached. We need good adherence between the plate and the skin of the patient. No space between the plate and the patient's skin. Why? Because I need the current to move inside the patient body. I don't need any amount of electricity to escape. If any amount of the density or the electricity escaped from the plate to the skin of the patient, it will cause burns. This is the idea of monopolar diathermy. Let's answer this question and revise together how the diathermy works. What is the frequency of electric current used in electrosurgery? It's about 500 hertz. Maximum, by the way. Okay? 500 hertz. Okay, before we answer this question, let's revise some basic principles about diathermy. This is the difference between bipolar and monopolar diathermy. What happens in monopolar diathermy? In monopolar diathermy, or any kind of diathermy, let's talk generally and then describe each type. Generally, I need for electricity to reach someone, I need a circuit. Okay? In diathermy, I'm using the source of electricity to generate energy or heat. Correct? So I'm transforming the electricity or electric waves to heat. Sometimes this heat is big enough to cause cutting or coagulation, and sometimes it's not big enough to cause this. It will cause only heating effect. Like what? Like the devices we use in physiotherapy. The devices which we use in physiotherapy only cause some heating effect or vibration effect. Okay? So it's according to the voltage. Now we are talking about the diathermy. Diathermy means I'm going to confirm or convert this electricity, okay, to heat. How? I'm going to use a device which called electrosurgical unit. This device will take the electricity from the wall. Okay, and by the way, the electricity from the wall is low voltage, which is the electricity in the buildings and everything. It's low, have low voltage, okay? And convert it into high voltage, AC current, AC, not direct. And why it's AC? Because I can use two forms. It's not only one form. The current is alternating. Alternating means sometimes it's the low voltage can have low frequency, sometimes high frequency. Direct current will have stable frequency all over the time. So if you are using a high voltage, it will cause burn. Like what? Like the cautery. You know the cautery that we used to do to the cervix extrusions, for example, previously, electrical loops. The cautery that the dermatologist used for some of the skin conditions. This is direct current. It's always with the same frequency. Alternating current means the frequency changes with time. So diathermy is alternating current, not direct current. This is for one. Second thing, I'm going to change this low voltage to high voltage, okay? Then I'm going to transmit it through a cable. This cable will end in 2 probes or 1 probe. If it ends in 2 probes, we call it bipolar diathermy. So the electricity will move here in the cable, get out to one end, okay, move to the another probe, then move back to the device or the electrosurgical unit. This is bipolar diathermy. Is the patient a part of this circuit? Yes or no? Is the patient here a part of this electrical circuit? No. Okay? No, he is not. In monopolar diathermy, again, the electricity will move in the cable and it will get out from this probe. This probe touch the patient or near the patient. The electric waves will move through the patient in his body and return back to the device through the attached plate. Then the electric waves will go back to the electrosurgical unit through this return plate. We call it return plate or returning pad. Okay? In this type, the patient is apart from the circuit. So I need to protect him. If the patient is wearing any types of metals, this type of diathermy cannot be used. If the patient is having a synthetic valve, for example, or metal valve in his heart, this type of electricity cannot be used. Why? Because the electricity moves inside the patient's body. What happens if this plate is detached, not firmly attached? There will be escape of electric current, which is high voltage, as we said. This current that has escaped will cause electric burns in this area of the skin. This is a common complication of monopolar diathermy when the attached plate or return plate is not firmly attached to the patient's side. Okay, I need all